renin-angiotensin-aldosterone system.
Hi, Mr. Jones. How are you?
I'm doing good, thank you.
Great. Now let's see. It's been about a month since you were in the hospital with the heart attack and we put in that coronary stent. How are you feeling?
Oh, I'm feeling great. I feel like a new man.
Excellent. Glad to hear that. And how are you doing with all your medicines?
You know, I can't tell you how good I feel since you put in that stent.
Good. So I assume that you're taking all your medications.
Like I said, I feel just fine.
Mr. Jones has several risk factors for heart disease: stress, high blood pressure, high cholesterol levels, his age, and smoking. 1 month ago, Mr. Jones suffered a myocardial infarction, or MI. After an MI, the goal of treatment and care is to limit the size of the infarct and restore the heart to its highest level of function. Persons suffering a myocardial infarction are at increased mortality and morbidity risk. The American College of Cardiology Foundation and American Heart Association recommends aggressive secondary prevention via pharmaceutical interventions to lower risk for recurrent cardiac events and death. Each of 5 evidence-based pharmaceutical interventions works to lessen the demands on the cardiovascular system following myocardial infarction. Could you answer questions or address concerns Mr. Jones has about his medications? We are currently focusing on the strategy to relax the body's blood vessels. In order to understand how the body monitors and adjusts blood pressure, let's take a look at the renin-angiotensin-aldosterone system, or RAAS. The kidney is an amazing organ that performs many critical functions. One of its most important functions is continually monitoring blood pressure. 3 triggers will elicit a kidney response: a sympathetic nervous system response and a low blood sodium concentration response are the topics of other videos. The focus of this video is the response to low blood pressure. In this slide, the red cars represent the flow of blood through an artery. The kidneys, depicted above the artery, are continually monitoring blood pressure. Notice the same blood volume, depicted by the same number of red cars, is now moving through an enlarged artery, representing vasodilation. The ever-astute kidneys sense a drop in blood pressure. Angiotensinogen is an otherwise inactive hormone released into the bloodstream by the liver. A low blood pressure trigger sensed by the kidneys results in the dumping of an enzyme called renin into the bloodstream. The hormone angiotensinogen is chopped by the enzyme renin to produce angiotensin-1. Angiotensin-1 is converted to another hormone, angiotensin-2, by an enzyme called angiotensin-converting enzyme, or ACE, in the lungs. Angiotensin-2 is a powerful vasoconstrictor. Depicted here as keys, angiotensin-2 locks receptors in the lining of the blood vessels, causing the vessels to tighten. Constriction of blood vessels increases blood pressure. Now let's review. The body monitors and changes blood pressure through both vasodilation and vasoconstriction. The liver is constantly dumping a hormone into the bloodstream called angiotensinogen. After sensing a drop in blood pressure, the kidneys dump an enzyme called renin into the bloodstream. The enzyme renin cuts the hormone angiotensinogen to create another hormone called angiotensin-1. The hormone angiotensin-1 flows to the lungs, where another enzyme called angiotensin-converting enzyme converts to angiotensin-2. Angiotensin-2, a powerful vasoconstrictor, locked the blood vessels at the angiotensin receptors, narrowing the blood vessels and increasing blood pressure. Chronic increases in blood pressure are a risk factor for myocardial infarction and subsequent MIs for patients surviving their first cardiac event. Please proceed to the next video to learn more about treatments for high blood pressure using angiotensin medications.